what happens and what are the reasons for this to actually happen. Joining us here in the program is our guest, Professor Dr. Khalid Taibah, who is actually an expert, and we are going to be discussing with him this more in depth. Professor Dr. Khalid Taibah is working with Al Faisal University's College of Medicine and is the consultant otolaryngologist and head of the neck and cochlear implant surgery as well, and is also the general manager of the ENT Medical Center. And well, we are going to be talking to Professor Dr. Khalid first, welcoming him to the program. Assalamu alaikum, Professor Khalid, and welcome to the program.
Alaikum salam. Thank you very much. Good morning, everybody. I'm very happy to be with you today to discuss issue which is quite right this time because of the changing the weather. A lot of people coughing and they have problem with their voice box, which is, we call it larynx. And of course the vocal cord is the organ which produce the sound, and we could talk about the function. You like we start with this maybe? If you don't mind, you put the first video, which you could put it on. The first of all, the I don't see it, but as it runs now, you could see the vocal cord, very simple organ inside a cartilage, which is like when you touch the tip of your nose, that's a cartilage, and the muscles which pull the elastic fiber and muscles, which two of them only, if it is on the screen, you could see the two cords moving, producing the sound. Not only that, most important is to bring the air inside the lung, where we could breathe. Without oxygen, without air in the inside the lung, the oxygen is needed for every single inch in our body, including the brain, the heart, and so on and so forth. So this is very important organ. That's the entry for the air for our life, to continue to have this larynx, voice box, and the vocal cord had to be moved in and out, outside and inside, so we could breathe. We could clear also any problem inside our windpipe or airway by using the vocal cord to push things out by what we call it coughing. And also
we have the slide on the screen right now, as you can see.
Now you go to the previous film where indicate what I just talked. The one before that, could you put it on? If not, then we could use this one.
We could go to the previous picture.
The previous,
yeah.
No, this the next, the one before, the one before.
The one before.
One before that. If not, then okay. So I could put it from here.
Yeah, you could put it from here.
All right.
Change it in. Yeah.
Okay, so this is it. Now you could look at it. Look at this very nice instrument. If you could put the camera, it's.
Exactly. Yeah, please continue, Professor, and as you can see,
okay.
also the technology. Yeah?
So now we could go to the third option or third function, which is the sound and the quality. As you could hear it here, that's the difference between women and men.
The sound itself.
The sound itself. That's very. When you look at it in the dissection or in picture like this, you don't see that difference. But Almighty Allah create a lot, and that's for human different than any other creature, which produce the language. Other creature, they don't have language.
True. Professor, can I also ask you a question? In some type of example, you hear like a man who has a close to a woman's voice, for example. Does that also has to do with and the other way around? For example, you hear a woman's voice, and she has a man's voice, you know. Woman, like, I mean, you hear her sound is a little bit tough.
Right. This can happen, and that's need a therapist, which we're going to talk about it later on when we part of the treatment for inflammation. But this could be a congenital or behavior. Since birth, there is a problem, no direction how
so it's not from the vocal cord
or anomaly in the vocal cords to produce this difference in the sound. So If you could, I don't know if you could bring the next movie, which is here. I'm gonna put it on, and it show you the difference now. Look, this is the function of the vocal cord. Yes, this is the first video which I'm trying to reach in the beginning.
And this is what's happening when you're coughing.
When you cough, when you talk, this is the cord moving, and this vibration is very naive in a sense. There is what we call it vocal cord. The proper name is fold. You see, this is the sound for a woman singing and producing the sound of a high pitch, high frequency. Man had a lower frequency.
Oh.
Yes, okay. And that's why my voice is more stronger, and while the women and the girls, they have, you could see here the difference now. And that's only just 2 folds. And when you look at it with the endoscope, like we're gonna show you later, and now you could have the next of this. Yes, could you, now we'll put this on. Yes, you see the difference now between man and woman. Larynx, when you look at them, there is no much big difference. But
Sure.
you could hear the difference in terms of the sound produced from a man or woman or girl or boy. And as we mentioned before, there is very important function for the larynx. It's protection, it's airway, it's producing sound, and coughing. Coughing is to take all bad things inside the lung to become outside, like a foreign body or anything you by mistake ingested inside your airway. So this is basically the function of the larynx.
Indeed. Now with this, moving on, as today our subject of discussion, Professor Dr. Khalid, is the inflammation of the vocal cords. Now, what are the causes and what are the reasons behind an inflammation of the vocal cords to be happening?
Right, there is many causes, but let's get few of them which is most common. Mainly is inflammation because of viral, that's the most common. We call it like common cold. Also, they could turn to become bacterial. That's because like what we have, we call it bronchitis and laryngitis because of bacterial reason. The other reason which is more common, as it is if inflammation because of virus or bacteria, is abuse of the voice. We don't respect this nice instrument we have.
Are we abusing our voice by
of course,
talking for 3 hours
you guys are abusing your voice when you having a lot of programs and speak a lot. So as a speaker, too much, like if it is not well organized and there is a lot of strain, like the singers, like the teacher, lawyers and imam in the mosque, especially in Taraweeh, a lot of people, they come
shouting also comes
shouting, any abuse of the voice. And the abuse, by the way, is not only shouting. Any strain in the muscle could be also by whispering, believe it or not. When you whisper, you injure, as you see, the vocal cord move very nicely. We'll go to the next one. And
we have a picture on the screen, Dr. Khalid.
Yes, now we put it on, and this is see what happened here. This vocal cord covered by very nice thin mucosal fold. It's like a waves in the ocean. It moves, and it moves the air and produce the sound. And you could make it too much work on this folds, and this will lead to injury and inflammation of the cord, either by shouting or whispering. Okay. So the other causes could be because of reflux. A lot of people, they come and they don't pay attention that when they have heartburn, and if there is little bit of acid comes out from their eating pipe, which is esophagus, to the windpipe, which is the larynx and the trachea, this little bit of acid could cause a problem, inflammation in these vocal cords and in the larynx. And the patient wake up in the morning, he had bad taste, as well as almost like his voice become hoarse, not normal. It's a low pitch, like when he talk like this. We call it baha in Arabic, which is hoarseness.
This is from what?
This is because of the acid. This is a third reason for inflammation of
By
the
acid,
vocal
you mean,
cord.
for example,
We could have
smoking,
this movie.
this
I'm
kind of
sorry, I'm
work.
just keeping you in and out for movies, but because
No,
it is
but
a complicated.
I think seeing it is understanding it,
Right.
Dr. Khalid.
Now we go to this one here. Now you could see this is the vocal cord, and this is just kind of animation. This is the black is the acid comes from esophagus and hit the vocal cord, and once it hit the vocal cord, it is injurious. It leads to inflammation because the acid inside the stomach, there is a lot of gastric fluids and the juices, and there is a protection for it. But when it comes to another area, which is because of the reflux, which means that the valve at the eating pipe, which is the esophagus, is not functioning well at the junction of the stomach. So the acid escape upward, and then it hit the larynx, like what you see here. This is the inflammation takes place in the larynx. A fourth reason could be allergy. And that's, you could see it. But most important, and that's why I'm here possibly, because of smoking. Smoking is bad. So this is a chemical injury, nicotine, and a lot of hundred of substance inside this cigarette or pipe or name it. All this very, not only injury making inflammation, but inshallah not, it could end to cancer. So this is again another cause of inflammation. Of course, when you talk about other reason, which is trauma, could be direct trauma or by occupational trauma, by inhaling smoke or anything in inhalants inside the environments which go inside the larynx. It will cause injury to the larynx.
Certainly, but as you have mentioned, smoking, Professor Dr. Khalid Taibah. Now, is it smokers who are smoking? Is it smokers who are inhaling? Is it people who are inhaling the secondhand smoke, or what?
All of the above.
Okay.
That's too bad. And you look to this again, my video for one patient here come to me. This one will show you. He smoked heavily smoker, and he came with the very hoarse voice. When I scope him, and you could see his larynx is very red, and his vocal cord in both sides here they are very inflamed. And when I advised him not to smoke, and he came back in a month later, and you could see it, just watch the video now. Look at his larynx, it become more nice. It's still swollen, but the vocal cord return its color to become white. And he stopped smoking and almost so appreciated. And unfortunately, he is in from another far city to bring him here. He was ready, but he's not with, because he's so much appreciated, not only for inflammation in his larynx, but the rest of his life, rest of his function and body, as well as finance and so on and so forth. So this is a campaign against smoking.
So unfortunately, it takes an expert to really see a condition, to notice it, and to really scare a patient that, well, if you do not give up smoking, this is what's going to happen, is only when he is going to avoid it or stop it. But while life is going smooth and good, he's not really going to consider it whenever it is that you continue to give the warnings of how bad smoking is to your health. Well, Dr. Khalid, I mean, certainly, I think that we should do a session completely dedicated to smokers one day.
More than happy, and not only one session, many sessions, to convince our friends who smoke. And second, smoking also is important, especially children.
Definitely. I mean, smoking is negative in so many ways also.
Right.
Their voice. But also, I'm the professor going to our third, let me say, I'm also questioning today. Let me say the relation between the grastic, also reflex, and the sound imprint also, or disappearance sometimes. You hear also the disappearance in the sound itself.
Right.
Where does that come from?
That's because of the, you mentioned the reflex. So that's, you wake up and you find your voice is a change. And then we need to, if we want to solve this problem, in particular, that we send the patient to our colleague gastroenterologist, because they may be needing investigation, could be X-ray, as well as endoscopy, like passing a scope not only like what we saw just to the larynx, but go all the way down to the stomach and to study the situation and then give a treatment, because the treatment could be a remedy from the gastroenterologist and advice from us, as well as the dietitian, the habit, like you eat at night late and sleep, that's not good, because you wake up with this reflux, then you lose your voice. And how is the position when you have a reflux, and then there is medication for it, and also diet to reduce the weight, and so on and so forth. So it is important. This may be the sign and symptoms that bring the patient to medical awareness, which is the inflammation in the larynx and the problem within the stomach and the reflux.
Well, so Walid, we get to see that, I mean, eating a late meal and then going straight to sleep, especially after that, without us being even able to digest the food to a certain extent, is not only dangerous for us in terms of gaining weight, but as well as could be very, very dangerous when it comes to our vocal cords, and could actually lead to sound impairment or actually even the disappearance of it. So this is something we need to be very careful about. We always recommend it to you all, with all the experts, dietitians, doctors, medical experts in different fields. As they mentioned, that at least you have to be having your dinner 3 to 4 hours before your bedtime. This is something which is definitely very, very important. Now, with this, moving on further with Professor Dr. Khalid. Now, doctor, tell us about the therapy of the vocal cords inflammation. Let's say if somebody is there who has developed this condition of the inflammation of the vocal cords, what is the possibility of turning it into a chronic disease in some cases, given if it's left untreated?
Well, usually the situation come all of a sudden or gradually increase in its intensity. But if we give the diagnosis, what is the reason, we just mentioned it before, and then we give therapy, and the therapy most of the time is just something to avoid those factors. So, for instance, those who get a viral, let's say, repeat it again, or common cold, this will disappear after a week with some supportive medicine. Like, for instance, avoid abusing the voice during this time. Make these muscles and the vocal cord vault to relax and talk normally, not to shout, not to whisper. Use a lot of humidification in the bedroom or at the work site. Drink a lot of water, and avoid acid if there is an acid in there, as well as to use some remedy, which we're going to talk later about it. But maybe we add to that antibiotic if it is the suspicion that it is a bacterial inflammation. And the patient had to come and visit the doctor. Now, when you question, the second part of it will become chronic for weeks and months, this is definitely need to be seen by a specialist, ENT specialist, to scope, because we are worried, especially for the smoker, that they could be holding something need to be further investigation and intervention. The chronicity could be, I mean, chronicity means the things become very continuous, to have the hoarseness and bad voice. Could be a vocal cord nodules. That's because of the abuse. We call it, by the way, it's a single nodules. Like 2 nodules in the vocal cord become like a weight bearing on the folds, the movement of the folds, so the voice will become not natural. We going to show you these nodules in the surgical management, which I could put it now, because that's what when we treat the chronic problem. But before we go to surgery, we send this patient abusing their voice to speech pathologists. Speech pathologists train them for 2 months or so. The reason for that, 2 purposes. Number one, this chronic problem could be solved just by speech therapy session, and they have to follow it. And the second, if it doesn't disappear by the speech therapy and follow-up later on when we examine them, then when we do the surgery and we take the vocal cord nodules or polyp or cyst, as like what I'm going to show you, at least they don't go back to this bad habit. So they're trained in 2 months. After the surgery, they don't repeat the same things to have it again, because this can come back again. Well, let's see this in the video for surgery. And it is here. We could,
tell us about the surgical intervention, Dr. Khalid,
it is
as well.
running now. That's the patient. Under general anesthesia, we go through scope, through the mouth, and this is the vocal cord being affected by nodules. And then we catch under microscope, highly magnified, you could see the disease being removed.
So this is a non-invasive surgery?
This is, it is invasive, but it is not through cutting the skin. It's through the larynx itself.
Okay.
But I'm cutting, so it's invasive, because I remove that nodule, and you could see this. This is, again, like a cyst inside the vocal cord, and that's what to make the voice is husky. And by dissecting it under microscope in the surgery, a patient completely sleep, and this is the scope going through his airway, and the mass being removed, dissected nicely without injuring the vocal cord. It may be injured for a couple of weeks, and then it come back again.
Okay, so now is this a way to deflate actually the nodule, or is it completely removed?
Take it out, remove surgically. Now it is completely
and
removed.
Then is there some stitching, something?
No, we just take the cyst out by laser or by micro dissection, and it will heal by itself without need for suturing. It's very minute. You talk about this magnified, and we're talking about very minute. It is delicate surgery and had to be done by expertise, because this could be a really long-term damaging if it's not done well.
But Dr. Khalid, like, the husky voice, sometimes, we get to hear some of our most favorite actors, like Al Pacino, for example. I mean, one of our favorites.
Yes.
Now, he does not really have a standard voice or a normal voice. It's extremely husky voice. Now, people who have husky voices, if they have it, let's say, from their childhood, so does that mean that they do not necessarily have this problem? Or people who all of a sudden develop a husky voice, like our director, Mr. Abdurrahman Al-Angari, we get to see his voice is getting more and more husky by the day. Each passing day we hear him getting his voice more and more husky.
Well, I was very delighted to, of course, to see him now, and I know the reason, so I will leave it to him to come to the clinic to help him. And this organ, either you abuse it by anything, but the most important is to be early in life, to be trained to go to speech pathologist. And they, or even the phoniatrician. And there is those who, their voice is their talent, and their life depend financially on their voice. I appeal to them to take this advice and not to abuse their voice, and to keep themselves in a very harmonic way when they talk and when they speak.
Exactly. Professor, I'm also going to also, is the treatment, let me say, by herbs also, is it also useful to the vocal cords?
Yes, that's proof itself long way in centuries. As you could see here in the last picture.
We have it on the screen, Dr. Khalid.
You have it in the screen. So this is, you could have lemon in your, it's a kitchen thing. So you could have garlic, you have ginger root, you have lemon, you could have honey, you could have salt and water, gargling, and each one of these remedy had something in it which proved by different study it helped to make this period when the sound is affected because of the inflammation to get gradually improve the symptoms. So it is a supportive. But the most important is the voice rest. Most important to have a lot of fluids, because there is a gland inside this organ which produce saliva and help. So you need to drink a lot of water. Now this remedy like lemon juice is antiseptic, antibacterial, antiviral.
So these are your tips to avoid any inflammation of the vocal cords.
Right, and you use this regimen to support. But the most important to avoid the reason why you lose your voice.
So no smoking, cessation of smoking, taking citrus juices.
Great point.
No, well, let's go with the, you are right, so you said no smoking, no acid, reflux, I mean, no abuse of the voice.
That means eating at least 3 to 4 hours before bedtime.
Right, or avoid any things which create this heartburn for you.
Okay, so heavy meals or big meals.
Heavy meal, and avoid abusing your voice. If there is allergy to be treated, this allergy, you could use cortisone, spray, and so on and so forth. I didn't mention the cortisone. When it's become so chronic, it's because people hesitant to use oral systemic steroid to get rid of this. And sometimes we need to do that when it's become very edematous. And inflammation in children, that could be a life-threatening. We call it croup. That's need to be beyond the scope of this discussion, need really awareness when there is a problem, husky voice, and the child cannot really breathe well, had to go to the emergency room. And
exactly.
That's a very important issue to mention.
Indeed, Dr. Khalid. But Dr. Khalid, with this, we would like to thank you so much for joining us in today's edition of the program, for talking to us more about the vocal cords, their sensitivity, how it is that we need to be taking care of it, and how it is that by simple home remedies and a little bit of, let's say, more discipline, we could avoid some of the complications of the vocal cords. We thank you very much for taking out your time for joining us in today's edition of the program. We were joined in discussion with Professor Dr. Khalid Taibah, who is from Al Faisal University's College of Medicine, is a consultant otolaryngologist, ENT doctor, and head of the neck and cochlear implant surgery, as well as the general manager of ENT Medical Center. We thank him very, very much. If you have any questions that you would like to address to Dr. Professor Khalid Taibah, then you could actually forward those to us via our social networking websites, where you find us on Twitter and Facebook, or you could also send us an email. Thank you once again, Dr. Khalid, for joining us.
Thank you for
Thanks a
your
lot, sir. It was a pleasure.
Thank you.
Thank you.